Hello, everyone, and welcome to my applied assignment slideshow presentation. My name is Lillian Smith, and we'll go ahead and get started. So, for the table of contents, we'll go through pre work, the topic, why, prior knowledge, the course materials, and my research that I did. The research, of course, and showing you new learning, all the things that I learned with the evidence and the connections, and then our continued inquiry. So, for the first part of our pre work, my topic was individuals who have multiple disabilities. Why I chose this is to understand how difficult it can be to live your day to day life with different disabilities, and the aspect of inclusion was healthcare. So for my interview, I interviewed my grandpa, Douglas Smith. I chose to interview him because my grandpa has multiple disabilities due to the military and from a few car accidents. He takes many medications, and it can be difficult for him to do some of the activities he enjoys. My background knowledge is I would tag along with him to doctor's appointments when I was younger, and I had always seen all the different things he has to take in order to live his life to the fullest. So, for course materials, the first link I chose was people with learning disabilities still face unacceptable inequalities in healthcare. So, why I used it, my grandpa has mentioned in the past how it has taken months to get a hold of a doctor to figure out what is going on with his health. And this article talks about good, high quality care should be expected for everyone. We wouldn't accept this kind of poor care for cancer patients, so there is no reason why it is acceptable for people with learning disabilities. Although he does not have a learning disability, he still suffers and should not have to wait. My second resource was a systematic review of access to general health care services for people with disabilities in low and middle income countries. So why I used it, people with disabilities often occupy a marginalized position in society and so may be more vulnerable to poor healthcare due to poverty and adverse living conditions. This means that on average, people with disabilities will have poorer health than people without disabilities. Luckily, my grandpa has had access to the military hospital, but what would have happened if he didn't? My third citation or third link that I chose was International Journal for Equity in Health. So, why I used it, this article also talks about how those who have disabilities face several barriers in their effort to access healthcare services and report higher unmet healthcare needs compared to those who do not have disabilities. And my last citation was from Achieving Accessible Healthcare for People with Disabilities, Why the ADA is Only Part of the Solution. This article analyzes some of the factors that make accessible healthcare so difficult to achieve. I use these two articles as they talk about similar things. My grandpa has had to wait a long time to get a response from a doctor or even be seen. Although they were not emergencies, the constant of waiting of things he needs is annoying. So, second, for my evidence, this was the interview I conducted with my grandpa. So, the first question I asked was, what do you wish people better understood about disability? And his response was, disabilities exist, but you can still live with disabilities. It is not a death sentence. The second question was, what are some challenges you face while having these disabilities? Being able to walk long distances, and he said he has to be careful of what he does every day. What caused these disabilities? His answer was the road marches at Fort Ord, California, carrying 60-pound rucksacks for miles and miles. My fourth question was, how hard is it to do everyday activities? It is more difficult. I do not like to be on my feet for a long amount of time. If I have to work or if I have work to do, I would prefer to do it while sitting down. Yard work gets hard, as I also enjoy that, and he gets fatigued a lot easier. The fifth question was, does it get obnoxious having to take many different medications? His response, no, it is something that you get used to, and he takes medications for diabetes and pain. The sixth question was, how many times a year do you go to the doctor? His response was, I go twice a year, maybe more depending on what is going on with my pain and body. And the last question, how do you expect these disabilities will affect you in the future? His response was, I expect they will not get any better, but I do whatever I can so that they do not get any worse or get worse any quicker. And then below is the picture of me texting him about when our meeting is going to take place and where it was going to take place with his confirmation. So for new learning, for inclusion, so for the evidence part, I use the what do we really mean by inclusion citation. And this section I wrote Inclusion means understanding the relationship between the way people function and how they participate in society, and making sure everybody has the same opportunities to participate in every aspect of their life to the best of their abilities and desires. The citation I use mainly talks about individuals but with autism, but still explains it in the same for each disability. It is essential that we ensure that autistic individuals' voices are not merely considered, but also amplified in discussions around community engagement and inclusion. Being clear in our terminology and putting autistic individuals in the driver's seat will help to ensure that the community engagement efforts are moving toward true, meaningful inclusion for those on the autism spectrum. So for equity, I use the Disability and Equity for Institute of Children and Youth and Family Policy. So for equity, it says achieving health equity means creating environments in which every person can thrive. Yet, disability is often left out of the public and social equity frameworks. We as a community need to be sure to improve equity in education, and we must expand our thinking about what diversity is to include disability. And for access, the citation I used was from the Universal Design Toolkit of Living Laboratory. When it comes to access within disability, I knew that it can be difficult, but I got to learn about accessibility from Rosemary Rossetti. We learned about it through Universal Design. It provides insight to what universal design is with 7 different principles. I learned how I could use universal design in my Starbucks store to prevent more injuries and allow accessibility to everyone. So for my continued inquiry, I wrote for my what I want to know, what else I can do to improve my store to make it easier to navigate through. I plan on meeting with my store manager and her manager to redesign some areas of our store to prevent injury and help those with wheelchairs move around easier. Please ignore the question mark. I did not mean to put that, but we'll be moving on now. So for questions for my peers, my question was, how will you help those with a disability in your day-to-day life? Thanks so much for listening and looking through my slideshow with me. I hope you enjoyed.